Thank you, Noto, and ISOT organizers to offer this position for me to speak on expanding paired kidney exchange in India. My topic was actually should other than near-related donors for swab be allowed to prevent commercial transplants. So I put it like this: you need to expand paired kidney exchange. So to first, we need a consensus among all your nephrologists or all your transplant professionals. So this is Nephrology Association of Kerala supporting organ donation drive in their annual conference. So we all know that ACT has been since here for 30 years. We have a good transplant ecosystem. We had immunological sciences developed so much, and patient demographics have also evolved substantially. And we all know that disease donor program is still immature. We are not supplying the demand. And this is true, living donor program remains the backbone of renal transplantation in India. And we need to adapt our policies to reflect current medical realities and patient needs. That is most important point I need to stress. And we shouldn't forget the sociocultural, economic and healthcare disparities which require regionally adaptable policies over rigid national uniformity. So I actually disagree with this one nation, one policy. One nation, one policy is good, but at the level of states or at the level of districts, we need some other solutions for having a consensus to reach for exchanging. And our social fabric, this is very important. Our social fabric is very family-centered. Cousins, in-laws, and extended families share strong emotional and moral bonds. So we can't label them just as not near relative and disagree with their approval. And limiting near relatives to the statutory list as patients, siblings, children, spouse fails to reflect the cultural reality of our kinship. Altruism in extended family is culturally credible and should not be dismissed as a potential exploitation by default. So this is what all our DLACs do. Even you have a father-in-law donating, you say it's unrelated, you just disregard their donation. And medical and genetic realities already most of the speakers have alluded upon. 30% of renal transplant candidates have a willing donor who is blood group incompatible. And success of paired kidney exchange program depends on size and diversity of donor pool. That is why we need robust softwares which can pair these exchange programs. Restricting to near relatives constraints pool, reducing compatible matches and exchanges. And another important thing is 10 to 15% of CKD due to hereditary or familial causes. So extended relatives may be the ideal donor and not safe to use the genetically identical things. So this is an important landmark judgment which came in 2021 in Kerala. And High Court categorically stated that swab transplants permissible even if donor recipients not near relatives, provided special reason exists for donation. This is the Kerala High Court judgment, and it has, we'll just go through some of the excerpts from the judgment. So this is already, we all know. Section 9.3, this is very important. Unambiguously permits any donor to authorize the removal of any of his human organ. So it is not related or not related. It's an adult, he can say that I would like to, and it is only the Act demands is the prior approval of the authorization committee. So any adult can donate to anyone if there is a prior approval by the authorization committee. So this is very clear. And again, sub-rule 4 directs that swab donation shall be permissible only from near relatives. The Honorable High Court's judgment is to said that the extent rule 7.4 cannot stand the scrutiny of law. So he is telling this is on the contrary to the spirit of the THO Act. So, and also it takes away the powers conferred on the authorization committee, because authorization committee have the power to say yes or no to any donation. So if rule 7 says it's only for near relative, the judge is saying it cannot stand the scrutiny of law. So that law is very clear, you can go ahead with the unrelated swabs. So, and the judgment clearly says that swab transplants will be permissible even if each pair of donor recipients are not near relatives. So this is what I wanted to stress upon. There is no legal hurdle to go for unrelated swab transplants. And the provision under the head swab donation contained the guideline of altruistic. We had actually in 2018, we had issued a government guideline on swab donation, but there also we mentioned it is near-related swab, and he said it goes to the extent permit swab donation only near relatives will be inoperative. That is, he nullified that order of government of Kerala in 2018. So he categorically says that there is nothing called swab between near relatives or between any adult who give informed consent, and the transplant has to be done by the prior approval of authorization committee. So there is, so take it from the High Court, there is no contraindication to go for donation in unrelated swabs. And the petition said, set aside all the reports of the DLACs and asked the donor recipient pair to go for the donation. So what is the pragmatic path forward? We need to amend near relative to extend that. You extend your sociocultural things, and uncles, aunts, father-in-law and all should be included. Expand access to life-saving therapy without diluting ethical safeguard. That is very important. Collect outcome data. We all have big numbers in India. We have 18,000 transplants. What is the outcome? That is also very important, because we need quality in transplants. So ethical, psychosocial and outcome also should be important, because we can't leave all these donors unprotected and their life become physically miserable after some time. So we need to assess them even psychosocially also, how they feel after their successful donation. And the policy reform reflects the law spirit, prevent exploitation without blocking altruistic, culturally natural donations that save lives. That is the most important take-home message from me. SWAP is permissible and not relative. So we need to prioritize cultural evidence, medical evidence, and robust safeguards, advocate for amendments, support pilots, monitor outcomes. So I'm from a beautiful city of Kerala, and this is Team K Soto from Kerala. Thanks for patient listening.